Hi all, welcome back to Learn Nursing with Anu. Today we are going to discuss schizophrenia, one of the most important and frequently tested topics in psychiatric nursing. Schizophrenia is a chronic psychotic disorder and the term was coined by Eugen Bleuler in 1908. It comes from two Greek words, schizo means split, phren means mind. And importantly, this is not meant by split personality. Instead, schizophrenia meant by a split from reality where the person has difficulty distinguishing what is real from what is not. So, in definition, schizophrenia is a psychotic condition characterized by a disturbance in thinking, emotions, behavior, perception, and all occurring in the presence of clear consciousness. So, the consciousness will be clear, orientation is usually intact, and intelligence is not lost. However, due to disturbed thinking and perception, patients often show social withdrawal and poor occupational and social functioning. In epidemiology, it occurs in all cultures and affects about 1% of the population. Men and women are equally affected. And the age of onset, men usually between 15 to 25 years and women between 25 to 35 years. This means schizophrenia usually begins during the most productive years of life, making it highly disabling. And in etiology, which means why does schizophrenia occur? This is multifactorial, there is no single cause. So, in genetic factors, increases with family history. If the parent, like one parent is affected, 12% risk, and if both parents are affected, there is 40% risk, and if they are monozygotic twins, they have a higher risk. And genetics alone is not sufficient, so we can even move on to stress diathesis model, which is very important in case of schizophrenia. Diathesis means vulnerability that can be genetic or biological, and the stress is environmental or psychological trigger. Symptoms usually appear when stress interacts with vulnerability. Examples of stress like trauma, substance abuse, severe life events. And in biological factors, this is dopamine hypothesis, which usually happens like excess dopamine activity in certain brain areas leads to hallucination, delusions, and disorganized thinking. So this is why antipsychotic drugs which blocks dopamine are usually effective in schizo. Psychological factors like double-bind communication, family conflict, and hostile or over-controlling environments act as stressors and can trigger schizophrenia in vulnerable individuals. So, guys, so far we have discussed the definitions and causes of schizophrenia. Now, let's move on to the core signs and symptoms, including positive, negative, and disorganized features. So, you can identify them quickly in your nursing exams. We will also touch on to Schneider's first rank symptoms such as thought insertion, thought withdrawal, broadcasting, audible thoughts, voice commenting or discussing, and made actions or feelings, which are highly characteristics of schizophrenia and often appear in exam questions. Now let's look on to the positive symptoms of schizophrenia. Positive symptoms are abnormal experiences added to normal behavior. In other words, things that should not be present but are present. First thing is delusions. This is a false fixed belief that the patient holds strongly even when there is evidence against it. For example, if a patient say, my neighbors are poisoning my food, even though nothing is happening. And the common other types are persecution, like feeling threatened or harmed, grandiose delusion, believing that you are so powerful, reference thinking TV or radio messages are about you, and control delusions, feeling someone else controls your actions. These are few delusions. And in hallucination, this is a false sensory perception without any real stimulus. The common type of in schizophrenia is auditory hallucination. For example, you hear a voice saying you're worthless, go kill yourself. And other types are visual, seeing things that are in there. Tactile feels like insects crawling on the skin, olfactory, smelling unusual odors. And in disorganized speech, this happens because thinking is disturbed and making communications difficult. And a few things are loosening of association, in which ideas jump with no logical connections, neologism, making up new words, and echolalia, repeating what others say, and perseveration, repeating the same word again and again. For example, if we ask, "How are you feeling?" a patient might reply, feeling, sealing, healing, feeling, and this is a way how they respond to you in disorganized speech. And positive symptoms are usually easier to see and appear early and are treatable with antipsychotics. Next, let's discuss the negative symptoms of schizophrenia. These are loss or absence of normal functions and are harder to treat. So remember the 5 A's: flat affect, no emotional expression; eulogia, poverty of speech; evolution, lack of motivation; and hedonia is the inability to feel pleasure; and asociality, social withdrawal. Some patients also show disorganized or motor symptoms like poor grooming, odd behavior, or decreased self care. In catatonic schizophrenia, motor behavior is severely disturbed. For example, they show stupor, waxy flexibility, echolalia, or echopraxia. Catatonia is considered a medical emergency and requires urgent interventions. And there are different types of schizophrenia. Paranoid, which means mainly delusions and hallucinations. Best prognosis is there. Disorganized schizophrenia is disorganized speech and behavior will be exhibited with worst prognosis. Catatonia, prominent motor disturbance will be present. In residual schizophrenia, they have past psychotic episodes and current negative symptoms. In undifferentiated schizophrenia, they have mixed features of all the above. And treatments mainly involve antipsychotic medications like haloperidol, risperidone, olanzapine, or clozapine. And ECT is used in catatonia or treatment resistant cases. Nursing care focuses on safety, building trust, and therapeutic communication. So, in addition to medications and ECT, psychological therapies also play an important role in managing schizophrenia. Cognitive therapy helps patients identify and change distorted thoughts. In behavioral therapy, we focus on improving daily functioning and adaptive behaviors. In group therapy, we provide social support and encourage interaction with others. And in family therapy, we educate and support the family to reduce stress and improve communication. So, these therapies combined with medications help patients function better and maintain social relationship. Now, let's focus on nursing management, which are the key principles. When the patient comes to you, never argue with any patients who has delusions, and do not say that's not true, and acknowledge their feelings, focus on reality, maintain safety, be consistent, build trust, and especially if your patients are having hallucination, do not reinforce them, but maybe you can say, "I understand the voices feel real to you, but I don't hear them." And let's move on to common nursing diagnosis in schizophrenia. First one is disturbed thought process, which is most common. This can be related to severe anxiety or inability to trust or biochemical imbalance, and this is evidenced by delusions, suspiciousness, or disorganized thinking. And our main focus as a nurse is do not argue, focus on reality, and build trust. Second one is disturbed sensory perception, which can be evidenced by talking to self or responding to voices. And the nursing action which we can do is to ensure the safety of the patient and do not reinforce the hallucination. Third one is social isolation, and the nursing focus is short, frequent interaction, gradual involvement, and positive reinforcement. And impaired verbal communication, our focus is to use simple language, allow time to respond, and avoid rushing. And risk for violence, which is a very priority diagnosis, this can be related to command hallucination, paranoid delusion, and our actions can be made in a safe environment, close observation, and calm and firm approach. So, to summarize, schizophrenia is a chronic psychotic disorder marked by disturbance in thinking, perception, and behavior, while consciousness and intelligence remain intact. For exams, always remember the positive symptoms like delusion and hallucination, the negative symptoms using the 5 A's, the dopamine hypothesis, and the priority nursing interventions, especially safety and therapeutic communications. So, viewers, this was a quick recap on schizophrenia for exam purposes. If this video helped you, like this video, share it with your friends, and subscribe to Learn Nursing with Anu for more quick, clear, and NCLEX focused nursing revisions. Thank you for watching, and I'll see you in the next video.